Professor, Physician, Epidemiology. I am Dr. Sri Banerjee. I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member, and in this video I'm going to be going over a little bit about the anatomy of a cross-sectional study. So as you know, there's multiple types of study designs. There's cross-sectional, longitudinal case controls, and by now you probably have a little bit of a clue about what these mean and what some of the fundamentals are about these. But uh, we'll go through this a little bit more in this video. So for starters, everybody's looking to save money always, and so one thing that is important about the advantage of this type of study is that it can generate pretty robust findings without spending a whole lot of money. So that's one facet of cross-sectional studies. The second thing that's important is that both. So if you think of a study in terms of two variables, which I'm encouraging you to be thinking in terms of already, then if you have an explanatory variable and an outcome variable. So if you have two variables, those two variables are actually collected in one point in time. Now, I'm going to say this already, that this does not mean that you cannot collect variables for a time in the past. So what do I mean by this? So in a cross-sectional study, you can ask the person, do they remember when they were diagnosed from a specific type of chronic disease. So for instance, if they were diagnosed with rheumatoid arthritis, when was this? Was this 10 years ago? And so in that way, you can study relationships from something that has been pre-existing to maybe like a mortality outcome. So this might be a little bit more complex for you to understand at this point, but just know this, that the variables have been collected at one point in time. But with that said, you can also get historical information by collecting and asking the right questions. So optimal measure of association, then the third point here is that the optimal measure of association is the odds ratio. And typically you'll see this conducted through some sort of logistic regression. That's the most common type in social science research, or some other type of technique. So those are the key points. Now we're going to go into the second part of this video where I talk about some examples of cross-sectional studies. I'm going to give you lots and lots of examples of this, so stay tuned for the next part. So in this part of the video, I'm going to be talking more about cross-sectional studies using this Science Direct feature through Elsevier, in which these have been automatically generated using machine learning and heuristic technology. So this is a bit different than what you would find in a regular textbook, or even for that matter in a website, because these have been actually generated. And so I wanted to especially explore the cross-sectional topic. So when I do that, I typed in cross-sectional. There's several choices that pop up here, and the one that we want to focus our attention on is maybe try the cross-sectional model in social sciences, but that's not quite quite fitting the bill here. So let's take a look at cross-sectional study, and you can download this as a PDF, this topic page, and explore it on your own, or just directly explore it like we're going to be doing here. So just cross-sectional study, you can see the related terms, which means that these are all topic areas which lend itself well for cross-sectional studies, and people have conducted them. So you can just go to through the list. So we're going to be talking about vitamin D, bone density, obesity, sleep disordered breathing, diabetes, hypertension. So and just scroll through this group of articles and list. Starts with talking about in a population, so cross-sectional study that was conducted in reduction of teeth with decayed and missing and filled surfaces in a population. So this was between drinking coffee and not drinking coffee. And so that's one study, but then going into other topic areas which may be interest to you, talks about some epigenetics. And so cross-sectional study designs, this is an important point, are merely associations and they do not imply causation. And this is an important point for cross-sectional studies. Another point is that subjects, characteristics, and epigenetic measures are collected at one point or within a short time interval. So technically you don't know which came first. So there's other areas that are important. So for example, several of these CPGs have been found to be cross-sectionally associated with smoking status, being differently methylated between smokers and non-smokers. So when you look for associations, DNA methylation patterns could be a good area to be looking for in epigenetics. So you already start with this idea. Then when you investigate how to look at the associations in genomic studies and epigenetic studies, then this can be a good starting point for cross-sectional. Then another cross-sectional is bone mineral density. And that's done through a DEXA scan conventionally, and then also noted a lower lumbar spine bone mineral density. So again, this cannot determine the time during the transition when bone loss occurs or the rate of bone loss. So these are some limitations of the study. But another topic area which you could explore by looking further into the article. So just going into and exploring other topic areas, pharmacoepidemiology. This is a really interesting area because it's looking for kind of cross-sectional studies about how medications have an impact, exposure rates have an impact on a person. So there's many pharmacoepidemiological applications, and so you can go over this table a little bit. Target population, sample population without the outcome. So exposed versus unexposed, and then develops outcome, no outcome. So this is how you generate the design for a cross-sectional study. And you can go over that. So then the next one is looking at specifically cross-sectional studies are a sample of the population at one point in time, and this is something that resonates repeatedly, and estimate the prevalence of a condition, an infection, or a disease. So the survey tool, that may be a questionnaire, a physical assessment, so it doesn't preclude you from doing a physical assessment. So weight, height, blood pressure, even blood tests for HIV infection, malaria, parasites, diagnostic procedures, chest x-rays, for instance, in tuberculosis, that's important. But unlike prospective surveillance studies, cross-sectional studies do not provide information on incidents. So they may provide, for instance, in diseases with lifelong antibodies. And I've done antibody-related studies as well as it pertains to hepatitis B. But you can do the same thing with HIV and hepatitis A. Um, yeah, so one of my studies looked at cross-sectional associations, and in fact longitudinal associations between hepatitis B and mortality. So then looking at osteoporosis, again, bone mineral density comes up as an important look at also cortical bone loss. Another one on the right is looking at the prevalence of decisions to make in terms of surgical outcomes. And so this is looking at several surgical outcomes, also looking at a condition known as congenital diaphragmatic hernia. And this is typically seen in neonates, but there seemed to be an underdiagnosis of this condition because initially in Norway, the mortality from congenital diaphragmatic hernia was thought to be 30%. But when they found that they were comparing that to neonatal deaths from a comprehensive survey, they actually found that to be closer to 60%. So one in every 5,000 live births were actually CDH. So this is one example of how cross-sectional studies can actually reframe how we look at a disease condition and how common underdiagnosis is in many conditions, in many chronic conditions. And then osteoporosis in men, of course, I went over that. And then the cross-sectional study, of course, determines more the prevalence, the existing presence rather than the new incidence. So if the sample is chosen randomly, a frequency survey provides a valid snapshot of the characteristics of the source population, so it's representative. But you have to be careful to make it representative. This is another point that I'm going to make at this juncture, is the need to make these cross-sectional studies representative. And so if you're using a nationally representative sample, and this is more on the purview of biostatistics, but I'm going to make a call out to this, is that you have to be using sample weighting. And if you don't know what that terminology means now, that's okay, but we'll just say that that's something that you can kind of look at. So this was this study was looking more at chronic pain, which is another important aspect to be thinking about when you're thinking about chronic diseases, or any sort of disease, but lower back pain is very important. In fact, that's something that has really agitated patients, and sometimes in recent times, actually in current events, has led to shootings and things. So it's really important to be understanding pain, and also osteoarthritis pain is important. So osteoarthritis has been another condition that's important to consider. And then I'm going to end this with talking about the POPs, or the persistent organic pollutants. And so this is something that is really important in environmental health. And this affects women more so in terms of cardiovascular disease. And in National Health and Nutrition Examination Survey, an important survey that I use extensively in my research, is something that, yeah, you can look at a lot of environmental factors and see how this impacts the general population. So this is a whole handful of studies that I've gone over now to illustrate how many different topic areas this can apply to, and the caveats to be careful about the fact that how do you ensure representativeness in terms of causality, that this is not to say that this is a causal relationship, it's because it's being measured one point in time, but also the different unique ways that you can address some of the limitations that exist by using things like sample weighting and other techniques. This is a snapshot of what a cross-sectional study entails. Thank you for listening.